So I'd done a couple different practice management companies and saw no growth, yet spent a lot of money every month to those practice management companies. And so when Dr. Maurer had approached me about AMC, I'm like, I've done that. And he goes, well, it's different. And I'm like, oh yeah, well, I'm not sure I believed him, but I knew he was being successful, but I tried to explain, mention that to my wife a few times, and she's like, we've done this. And I was kind of, okay, I've done this too. Yeah, let's not. Some of those practice management companies had philosophy and some had procedures, but they didn't bring it all together in a way that was usable and doable in practice. I mean, literally I could walk into, after AMC, after first boot camp, and walk in and do those things and just worked, right?
Made sense, right?
It made sense to me, and it flowed well and matched with what I was looking for, and it wasn't forced. It wasn't memorizing scripts. Yeah. And I could see it being successful. I'd seen another doctor, Dr. Maurer's office, where, yeah, this works. I spent an afternoon in December at his office and just followed him around and just observed, and was just blown away. I saw a lot of patients, but everything flowed smooth. There was no chaos, and it was just like, wow, he saw more in an afternoon than I would see in a week, and yet he's just kind of relaxed.
Now that you've been with AMC since
January,
and now it's October,
right?
So in those months, those 10 months, what have you noticed?
Well, just obviously a lot of growth with the practice, doubling the practice, but just seeing, again, patients they're sticking around long enough to get great results. Like I said, everybody gets those miracle cases in 1 or 2 adjustments, but this is where patients are there and they're just seeing it, and there's no longer this discussion and trying to sell the next visit every time. We rarely discuss pain, and before it was all about pain. And so it's about health and getting them better. So
you're having fun?
Having fun.
Like what you're doing?
Like what I'm doing. This is different, and this works. In 10 years, if I'd done it 10 years ago, that's literally the difference in probably millions of dollars, millions of collections, and millions of results for patients and changing their lives. That they didn't stick around long enough because I didn't explain to them why they should stick around beyond the pain. So a lot of patients lost out too because I wasn't doing it right.